Representative Katiza-Watoon moves that House File 570 be brought before the committee. And this is a bill, members, that this is within our jurisdiction. So this one's going to be laid over because that's what we're doing with these spending bills within our jurisdiction. So we'll be doing that. So Representative Katiza-Watoon, so glad to have you. Please describe House File 570.
Thank you, Mr. Chair and members. I think we can go through this pretty quickly. Every day is a great day to talk about how we can support Minnesota's littlest learners and their families. And today I am especially excited to discuss a wonderful early childhood literacy program called Reach Out and Read. If you're not familiar with the amazing work that they do across the state and across the country, I'm privileged to be able to share. Reach Out and Read partners with clinics and pediatricians throughout Minnesota and assist them in implementing a literacy program that provides books to children between the ages of 6 months and 5 years at their regular well checks. According to the American Academy of Pediatrics, Reach Out and Read is the most studied and scaled prevention program which seeks to prevent gaps in readiness as they and before they emerge. So House File 570 would appropriate a $500,000 grant to Reach Out and Read Minnesota through the Minnesota Department of Education. I will allow my testifier to speak more in detail about the program expansion and the great work that they've done in partnership with the state over the past few years and their future goals as an organization. But I just want to speak very briefly on our focus here in this committee. We've been doing this work now together, Mr. Chair, in our previous committee, but we continue to hear that the first few years of a child's life are critical in brain development. Members may also be familiar with the million-word gap, or the difference between a child who has been read 5 books a day until they're 5 years old versus a child who has never been read to, just the difference in number of words in their vocabulary or that exposure. Well, based on calculations done from the Crane Center for Early Childhood Research and Policy at the Ohio State University, here's how many words a child would have heard by the time they were 5 years old. If they're never read to, they've probably only heard 4,662 words. 1 to 2 times a week they were read to, that jumps to 63,570 words. If you read 3 to 5 times a week together, goes up to 169,520 words. Daily is almost 300,000 words. And if you read 5 books a day to your child, they will have been exposed to almost 1.5 million words. So it quickly becomes an equity issue and ties directly into the long-reaching opportunity gaps that we have here in Minnesota, some of the worst in the nation. If families aren't able to build a home library, if parents are working multiple jobs or unable to procure books in their native language, if children don't see their caregivers modeling how to read, they may not have that chance to read independently or the opportunity of learning to read for pleasure. Reach Out and Read doctors are able to introduce a book and share with the child and their caregiver how to read, how to interact with that book, to turn the pages, to look at the pictures, and encourage them to read together daily at home. I enthusiastically support this program both as a legislator and as a parent. My children's eyes light up every time they visit our family doctor, and she has written little notes inside the covers to them. So it's been amazing for my kids, and I know so many children across the state benefit from this program. So now I would like to introduce Kristen Hopland, who's the Executive Director of Reach Out and Read Minnesota, to share more about how our support for this program directly impacts children and families across the state.
Thank you so much. Kristen Hopland, welcome. Please identify yourself and proceed.
Yes, thank you, Chair Pinto, and thank you to Representative Katiza-Watoon for her authorship of this bill. I am Chris Hopland. I'm the Executive Director of Reach Out and Read Minnesota. I'm humbled to represent this program, which is the product of the hard work and dedication to supporting young children and their families from both our team and the thousands of healthcare workers and clinic staff across Minnesota. I'm testifying today because I know our program is effective, and with the state's continued support, we can continue making smart, cost-effective investments in Minnesota's youngest families that will resonate for years to come. Our program model is supported by dozens of peer-reviewed studies. At every well-child visit, from infancy through age 5, clinicians trained in our program provide a book and early developmental guidance to young children and their families. Providers use the book as a launch pad to connect with families on a deeper level and assess cognitive and social emotional development, and to coach families on how best to support their child in this critical period of rapid growth. One of the great benefits of partnering with doctors is that they do appreciate research-backed approaches. It's because of our large body of research that we know how effective our program is. We know that families who participate read more often together in their homes, visit their local libraries more frequently, and are more likely to cite reading together as a favorite activity. We know that children's expressive and receptive language scores increase. One study in an underserved community showed language growth of 3 to 6 months among participating children. And finally, we know that participating clinics see higher rates of attendance at their well-child visits, and our program improves trust between healthcare providers and families. The American Academy of Pediatrics has endorsed Reach Out and Read and cited it as the most studied and scaled primary prevention program, which seeks to prevent gaps before they emerge. We want these results for every child in Minnesota, particularly those growing up in our most underserved communities. With the state's support, we can ensure that thousands of families across the state are getting high-quality books in their hands, along with the best evidence-based guidance for helping their children learn and grow. And thank you, Chair Pinto. I also have a written testimony from our medical director, Dr. Gigi Chawla, which I could read, or...
Yeah, typically not. I mean, how
No.
long is it? Yeah, if it's like maybe a paragraph, but I'm guessing it's probably a pretty lengthy thing. Yeah.
Mr. Chair, is that in members' packets?
You know,
Or
I'm not sure that that one is though, so we will get that out.
we can email it out. Okay,
Yeah.
thank you.
Yeah, thank you. Good, but I know Dr. Chawla does amazing work, of course. Good, thank you. So are there any public testifiers to this bill, House File 570? There is a letter in the packet and also a two-page sheet. A letter from the Minnesota chapter of the American Academy of Pediatrics and also Children's Minnesota. So seeing nobody come down for public testimony, up for member questions or comments. Representative Nelson.
Thank you, Mr. Chair. And, reading to my children has been one of the fun thing at bedtime. And, they pick out their favorite books, and I've been known to start falling asleep while reading, and, they will quickly nudge me, Dad, that's not how the story goes, and, correct me on Winnie the Pooh doing something or whatever it is, or, I think, reading is important. It's a bonding time, and it's also, this science shows the understanding of, the words they've heard. And I'm just wondering, does, probably for Ms.
Hoplin.
How big is your organization? Does it work with all clinics, or, what, if you could kind of give a little bit,
Yeah.
Yeah, a little, yeah.
size of it?
Yeah, a little more context. Actually, I do feel like that's helpful because it is expanding. And yeah, if you can just provide a little more context.
Absolutely. Thank you, Representative, for the question. We are in 306 clinics right now in Minnesota. So probably most, if not all of you, have a clinic in participating in your district. This would be continued state funding. And one of the things that that we've been doing so far with our state funding is to expand in greater Minnesota. We were very metro heavy with clinics being involved, and we really wanted to and had reason to expand in greater Minnesota. And so we've used that state funding to bring on new clinics, purchasing books for clinics while we find sustainable funding for them in their local communities. And so we've grown, even throughout the pandemic, we've grown quite a bit. So that's our hope, is to continue. I think the language in the bill states that, with continued support by 2030, that we would be in every clinic in Minnesota, serving every family in Minnesota. Right now, we're at about half.
Representative Nelson, follow up.
Thank you for that. And, I wanted to, make sure that we were, it was going to outstate clinics. I know that, clinics and doctor's office all across the state have different reading programs. Some of them are, through just the philanthropy of the community, of coming in and making sure that there's books available for children to read. And I just, I don't know if I have a whole lot more comment than that, but, I know that, local, there's a whole lot of local philanthropists that are helping out with, making sure books are available and partnering with that as well. So, thank you.
Thank you, Representative Nelson. Representative Lesniker.
Thank you, Chair, and thank you. I concur that reading is critical, and I've been visiting schools and see many partnerships with nonprofits and different organizations that have been fostering this success too. What I'm concerned about is the report that came out today on the oversight of state-funded grants to nonprofit organizations. And so it is signaling to us accountability and oversight. So for me, as a representative, I have concerns that we have systems and that we address what this report says before we add to that. And I just ask that we take some time to look at these recommendations before we add more programs. And there may be other ways to get reading at the local level. So I just encourage us to look at, to make sure, I want to make sure that we are responsibly having money go where it needs to go. We have systems at a state level, like we would in any home or business, that money is well spent. And so as I'm just looking at it now because it just came up. So that just was released today.
Can you say, Representative Lesniker, pardon me, the recommendations you're referring to, what is that report? I think I may have just missed that. It's the one.
It's oversight of state-funded grants to nonprofit organizations, February 2nd, 2023.
The legislative auditor report?
Yes, legislative auditor report.
you.
And it's talking about, the many recommendations it's saying is that the Minnesota Department of Education has established grants, but we have under review only partially compiled, that they are recommending that the grant management procedures provide more specific direction. And they have guidelines here asking us as state officials to take action on X so Y doesn't happen. And I think we have a responsibility to look at that as we increase funding. I'm all for reading, but I want to make sure it's happening in the appropriate way. Thank you.
No, thank you. And I should note again, this is just being laid over. Then we'll have our budget discussion coming up, into March. So we should have some time. And I certainly would encourage members, and I guess apparently me too, to review that. So yeah, thanks. I'm not sure if Representative Katiza-Watun or Ms. Hoppman wants to say anything regarding that, and no problem. If not, I'll have a few questions. But yeah, so we'll be looking at that. Can you just remind me and maybe inform members? So I think we first got funding for Reach Out and Read, state funding, when again? Maybe that's just one question, if you can, Ms. Hoppman.
The first year we received funding was 2019, and then funding was continued through ARPA.
Okay. And the amount again, Ms. Hoppman?
Currently, we are receiving $75,000 per year.
$75,000. And under the bill, this would be the $250,000. If this was enacted, it would be the $250,000. I think it would go into the base. So this would then be state funding to fund the program going statewide by 2030. Is that right?
Yes, that's correct.
Okay, good. And I'm just seeing if there's other questions or comments from anybody. When I've seen this presentation before, the talk, that I don't know if you use this phrase, but if you give us the books, because essentially maybe you can talk about what this money is paying for. What I've always heard is if you give us the books, we'll toss the doctors in for free. But if you could just explain that a little bit more about what are we buying if this were with this money?
Sure. Thank you, Chair Pinto. Absolutely. So a few things. We've used this funding to support the growth, like I said, almost exclusively in Greater Minnesota. What we do is we work with clinics, many of who are clamoring to come on, and we purchase the first year of their books for them. And then we take that time, which can be, we do have very low cost books, but several $1,000s. We're taking that time to work with clinic staff, leadership, healthcare management, and look at and see where the sustainable funding can come in, because we don't want them to just do the program for a year. We want it to be sustainable. So sometimes that comes through their operating budgets. Sometimes that comes from, as others have mentioned, local philanthropy, local community groups, civic groups. And so that's primarily what we've been using funding. We're also using state funding to help us support clinics by going out in person, visiting clinics, training the doctors, all of the doctors involved taking accredited training, training clinic staff in the model, and making sure clinics have everything they need and books that are in the languages that they need and that are culturally and developmentally appropriate.
Okay, good. Good. Anything further from members at all? Okay, so Representative Hicks, yeah.
Thank you so much for coming. I'm so excited about this program. I do just want to address the grants situation because I was also, looking at the report. And as someone who has been a part of grants conversations, I do want to just highlight that if you go to the recommendation section, the crusp of the report is that 3 people in state government are responsible for the grants management component. And so I hear a lot of times in this committee and in other committees and in this body as a whole about oversight. And yet when we start talking about the people needed to do the oversight is then when I start hearing things about adding FTEs. And so I just kind of want to go on the record as saying those 2 things must happen simultaneously. There is not a way to talk about oversight without talking about FTEs. So I just sort of wanted to throw that out there today because it's been talked about quite a bit, and I don't understand how we can pull apart the 2 things and not talk about them together.
All right, thank you, Representative Hicks. Representative Zaleznikar, back to you. Yeah.
Thank you, Chair. And I totally agree. I understand that question. I guess for me, looking at government's role with technology and systems in place, grants aren't a new thing, and there are a lot of grants that have been, awarded to very legitimate sources, and we've had great outcomes. I do think that there should be systems in place after all these years to assure that there can be efficiencies even if we have 3 FTEs, because that's the same thing we're held to in other standards with mandates in the state, in all the industries. So we need to make sure that we're looking at that, it's vetted, and that the systems are running, because this isn't something new. Every 2 years we have grants that are going to be awarded. So the processes and the system should be in place. And before we add, it's like before you build more buildings, you make sure you have the first couple buildings solid. So if we have grants that are out right now, we should make sure we have systems that have accountability for it, and then we add to it. Otherwise, it's not reasonable to think we would have a good outcome. And so thank you.
Thank you, Representative Zaleznikar. And I guess I might urge all of us, we know that there are needs that the people in the state have. It's our job to help meet those, to do so in a responsible way. We're going to be making budgeting decisions over the next couple months. And so I don't think it'll be I would argue it wouldn't be a good result for us to just, not do anything this session. Of course, we're going to be doing things. And so I think in the coming weeks, let's be diving into that report, other things, and thinking about how we can be making good decisions in the next couple months to make sure we are meeting needs and making sure we're doing so in the very best way possible. So that'll be important for us to do over the coming weeks. I don't see anybody else, so Lee Daniels will go to you and then the bill's author. Lee Daniels.
Thank you, Chair Pinto. And I agree with you on laying the bill over. That'll give the OLA time to spend in looking for those pervasive things that we were mentioning by Representative Zaleznikar, and so just give us more time to get into that and see what recommendations they have, and a lot of it was pointed back at the legislature, that the legislature should do that. So yeah, thank you for laying it over on the table, and hopefully we can have more information at our next meeting on this bill.
Thank you so much. So Representative Katiza-Butun, we'll close with you, please.
Thank you, Mr. Chair. And just to be clear, laying the bill over was the plan. This is in this committee's jurisdiction, and money would be coming out of our budget for this bill. So we're not laying it over because there's anything wrong with this bill or this program.
Yes.
And we're going to be making decisions on this program and many other programs as we complete our committee budget recommendations. I think that something really important to consider is that this program meets families where they are. They're already going to their well child visits, and it's not an extra step of their day. It's not an extra trip that they have to make. It's something that is already a part of the wellness of their child and their family. So I think that making sure that children and families all across the state have access to a clinic in their area, and like Ms. Hopland detailed, we have been expanding throughout greater Minnesota. I think that that's something that's very important, and I would appreciate the support of the committee as we go forward and make our budget decisions.
Thank you, Representative Katiza Watun. Yeah, it is unfortunate timing. It happened to be when that report came out. I have to say, I just, it's hard for me to think of a more impactful $75,000 that the state has been spending. Thinking about the power of that book in the pediatrician's hands and all the different things that can be done and is done in the room with the family, and then when the book is brought home. Really, really powerful. So this is a wonderful, wonderful program. Thank you so much to you, Ms. Hoplin. Please thank the many physicians involved as well. And with that, the chair does lay over House File 570 for possible inclusion in the budget bill.